Have you ever noticed how the stress affects your body? Your heart races up and you become tense. Do you know the stress can also wreak havoc on your bladder, the prostate, or even your sexual health? Today, we will dive deep into the psychology of the urological issues, how your mind and your emotions directly impact your urinary and reproductive health. So stay with me for a very fascinating look at the science behind stress and its unexpected effect on your body. So the relationship between the brain and the urinary symptoms, to be precise, is profound. Your bladder and the prostate are influenced by autonomic nervous system, the same system that controls your heartbeat as well as your digestion. So when you are stressed, your body enters into a situation, we call it fight or flight mode, releasing cortisols and certain chemicals, adrenaline. This alters the way your bladder contracts, impacts the blood flows to the prostate, and even affect your sexual functions. In fact, studies have shown that the chronic stress can increase the risk of lower urinary tract symptoms by up to 80% in some individuals. So let's talk about stress incontinence and overactive bladder. Stress incontinence occurs when there is an increase in the pressure, certain like coughing, sneezing, or even laughing, that causes sudden leakage of urine. But do you know that the chronic stress can weaken the pelvic floor muscles, making the problem even worse? On the other hand, if we talk about the overactive bladder symptoms, which lead to a sudden and a frequent urge to urinate, that has also been linked to a heightened or increased nervous system activity. A study in the Journal of Urology has found that the individuals with a high level of stress are generally almost like 2.5 times more likely to experience overactive bladder symptoms. So this means that the stress management is not just for the mental health, but is also crucial for the bladder control. So if you are a man over 40, pay close attention. Prolonged stress has been associated with the prostatic inflammations and even the worsening of the signs and symptoms of BPH. So one study reveals that any man with a high level of stress reported that 60% increase in urinary urgency or frequency. Stress-induced inflammations may also contribute to conditions like chronic prostatitis, which is the severe and long-term infection of the prostate causing severe pain and discomfort. Have you ever felt like your symptoms flare up when you become anxious? It's not just in your head, it is in your nervous systems at play. Now let's address a topic many shy away from, that is erectile dysfunction. Stress is a leading cause of psychological reasons for erection problem, impacting the blood flow and the nerve signaling. When stress activates the sympathetic nervous systems, the blood vessel constrict, making it even harder to achieve and maintain a rigid erections. Studies have shown that men under chronic stress have up to 40% higher risk of erectile dysfunctions. But there is a good news: managing stress through a relaxation technique or any form of therapy or even lifestyle changes like exercise can significantly improve your erectile function. Now it is a science-based, backed and the life-changing what you experience. So what you can do? Here are 3 science-based strategies to protect your bladder, prostate and the sexual health. The first one is mindfulness and meditation. Research shows that mindfulness can reduce the overactive bladder symptoms by almost like 30%. Deep breathing exercises also relax your pelvic muscles and improve the urinary control. The second one is the physical activity. Regular exercise lowers your cortisol levels, improve the blood flows and decrease the LUTs in up to 50% of male patients. Now the third one is the cognitive behavioral therapy. This helps to rewire the negative thought pattern and have been proven to improve both the bladder function and the erectile dysfunction symptoms. So by tackling stress head on, you are not just helping your mind, you are also safeguarding your urological health. Now these are the psychological basis of worsening or the emergence of the urological symptoms in you. And if you have any questions, you just write down in the comment box and continue watching my patient awareness series videos for more innovative, understandable topics. Thanks.